All right, welcome back from Kakaki Social to our second conversation this morning. It's the fourth Wednesday of the month on Kakaki, and that means that normalcy resumes, and we'll be talking about Kakaki Cancer Awareness, and that will be in collaboration with the Commot Cancer Foundation. And our focus this week will be on bowel cancer, and Commot Cancer Foundation CEO, Dr. Denise Ejoh, would lead the way with our guests. Good morning, Dr. Denise.
Good morning. Gosh, you look very good. You look very fine this morning. Oh my gosh.
That's not a compliment, doctor. You mean other mornings were not
It's a very
fine?
big compliment because you didn't wait for me to finish. I wanted to say to you, where is Bobo Right? Hey. Oh, Bobo Right. Hello, guys. How are you guys doing this morning? Let's go. Good morning, viewers. Welcome to another edition of our program, Kakaki Cancer Awareness, or rather, I now call it Commot Cancer Awareness, with Denise Ejoh, the CEO of Commot Cancer. I want to thank you all for joining us this morning as we start this program in partnership with AIT. So today we're talking about what happens after the life-changing words, "You have cancer," with a focus on bowel cancer, which my very nice guest told me is the same as colon cancer. You see, when I tell people I'm not a medical doctor, you understand where I'm coming from. So let's keep going. So what's bowel cancer? Bowel cancer remains one of the least talked about cancers in our environment, yet many are silently battling with it, often presenting late when treatments become difficult. Joining me this morning anyway is my very good brother, Dr. Biyi Olusegun-Olutunde, a consultant oncologist, and he's here to help us understand what patients truly face and what we must begin to do differently. So, Doc, good morning. Nice to see you. Nice to see your face after such a long time. We should go back to...
Hello, Dr. Dennis. Good morning. Always a delight to sit with you and chat about these important topics that have far-reaching effects. And thank you, Kakaki, for always being there to spread the good word.
Thank you. So, viewers, together we fight, together we win. Let's start this thing. Let's start from that moment no one forgets. And that is a very big statement, that point where no one forgets. Even me, 10 years on. Okay? After a patient hears the word, "You have cancer," particularly bowel cancer, stomach cancer, what are the most critical first steps they should take within the Nigerian health system? So, bearing in mind what we have to be practical.
I think that the first thing, as absurd as it will sound, is to say don't panic, because I've come to realize in all my years of practice that panic and the attendant fear that comes with it makes people make a host of wrong decisions. The panic, the fear, the terror that is associated with that diagnosis, while real, I'm acknowledging it. I mean, Dennis, you would know because you have heard this yourself. The initial panic and fear are things that have to just be tamed immediately so that you can actually tackle this from a place of quiet strength despite the turbulence that is, going on. I think it's so important to mention this because, again, just to reiterate, people make a lot of bad decisions when they panic. And some of these bad decisions come from well-intentioned people who actually think that they are helping, but in the long run, make things go from bad to worse. But having said that, a diagnosis of cancer, as scary as it is, it's a time to strap on your boots and start to move forward, because the earlier you tackle this problem, the better. And so the next best step would be to say, have I been correctly diagnosed? Am I seeing the right person to give me all of the information I have about this cancer? Has all the tests that need to be done, have they been done, so that I can be certain that, this is the type of cancer I have, this is the extent to which the cancer has gone, and then these are the treatment options. So I think one of the first few things is to just ensure that you are in the right place and in the right hand being treated. This becomes a challenge because unfortunately the health sector is not populated with as many specialists as one would want. And that means that a lot of times general practitioners who are excellent doctors in their own right in the general practice may be the first person to diagnose this, and therefore patients need to have proper referral pathways to the right doctors who can see them. And then they have to do all of the necessary investigations. I think one of the key ones would be a colonoscopy, where a camera is put on a flexible tube and introduced gently through the backside, and then they look inside to see where, if they can spot the tumor. They need to take a sample of it, send it for biopsy. And as soon as everything is properly done, patients need to start their treatment as quickly as possible. These are the steps that someone needs to take to ensure, once they've heard you, I think you have cancer, or we believe you have cancer, these are, I think, the general steps. So ensure, calm down, do all the investigations, preferably in the hands of a specialist. Once this has been diagnosed, the extent has been delineated, start your treatment as quickly as possible. Dennis.
Yeah, thank you. Every time I have to sit on this part and I have to recall my experience, I think, okay, how did I navigate that? Yeah, that's how I navigated it. I stopped. I cried. Like I say, I always tell people, we die, then you have to wake up very quickly.
Absolutely.
Very quickly, and then start. Okay. So basically stay on track. Okay, let's go. Okay, let me just ask you a very quick off the top. Can you give me the first top 3 signs that you would know that you're in that direction of bowel cancer?
Great. This is an excellent question, and I was hoping that it would come up, because I tried to answer your questions directly. Here's the thing. A lot of times, cancer is very, very quiet for years and years when it's in the body without you even knowing. So no symptom is not a reason to say you don't have cancer. And this is where we push the agenda of screening for common cancers. You did say that it's common. It is common, but people don't talk about it. And it has a very simple screening procedure where they just test for blood in the stool. Now, the presence of blood in the stool does not immediately say this is bowel cancer, but it allows you, as do all screening procedures, allows you to pursue to be sure if it is or if it is not. So the lack of symptoms does not mean don't take steps. I think people should always do screenings, and they should talk to their doctors to know about screening. For instance, if you're over 50 years, you should actually do a blood in stool test maybe every 2 years, except if there's a family history of that cancer, and then you have to request for it maybe a bit more frequently. But here are the common symptoms that people would have as the cancer begins to progress and starts to show signs. There's this feeling of bloatedness. There can be abdominal discomfort. Sometimes, commonly, people see blood in their stool. Unfortunately, if you've had what people term to be hemorrhoids or pile, and you've been seeing blood in your stool previously because of this, you would now be confused, thinking that that is what's still going on. But this time around, it's something more sinister, like bowel cancer. The other thing is that the blood does not always have to be red, especially if it's coming from higher up in the intestine. The blood may have been changed, so the stools look darker brown, or they look black when they come out because the blood in them has been altered. So if you see these abnormalities, you need to see someone. Unintentional weight loss, and also change in bowel habits, constipation irregularly, and then having diarrhea, or just having small stools, like they are hard, they come out in pebbles, or you are having very thin, instead of a robust adult size poo, you are noticing that you are having like a pencil-shaped poo. These are things that should really worry someone and make them go to see their doctor. Dennis.
Wow, I really like the way you explained this one. Very clear, very precise, thank you. I think we got it. So from your clinical experience, what are the most common challenges patients with bowel cancer in Nigeria face, especially when it comes to the timely diagnosis and treatment?
Dennis, this is the Nigerian situation. The challenges are there are too many. As a clinician, you're just always stumped by how many challenges a patient. As an oncologist, by the time a patient is sitting in front of me and they're telling me their story, it's just it just always makes you feel so bad because let's talk about money. Money seems to be the biggest thing. The funding for cancer is just not enough. People are still paying out of pocket, and in places where insurance covers, it's not blanket coverage. And so many people, the number of people who are living below the poverty line, they far exceed people above it. And these are the people who come down with a lot of these diseases. So they finding the help that they need, the financial help that they need to even go and see a doctor first, that I have a problem, to run the tests that are required of them, and then even when diagnosis has been made, to take up treatment. Then people pay as much as millions of naira for a session of chemotherapy when we're dealing with bowel cancer. Millions per session. And sometimes you need 6, sometimes you need 8, sometimes you're on it indefinitely per session of chemo. So it's a lot for people to deal with. I think one other thing is, culturally, we don't like discussing bowel habits. We're kind of like disgusted, like, oh, I noticed that there's blood in my stool. There's just this reluctance to talk about it. And I'm not even saying talk about it with people. I'm saying talk about it with your doctor. So sometimes someone will come to the hospital and be saying, I have pile, because it's easier to lump every problem that they have into that. And it takes a doctor teasing out all of this information, and this makes them always present late. So late presentation is just a big problem. So we've talked money, we've talked late presentation, we've talked about difficulty talking about these things, access to the care itself. Even sometimes when you have money, you can be a farmer in the village and have money, but getting access to care can be a challenge. Finding the place where we don't have enough diagnostic centers, we don't have enough hospitals, we don't have enough specialists, who are involved actively in the management of cancer and also in specific specialized areas. And these are problems that they come across every day. False information is something people are always dealing with. Oh, don't eat sugar, don't touch it, because if they do surgery on it, the cancer will spread. Oh, chemotherapy kills people. Challenges that just subdue the spirit and make patients run away from the hospital and not want to take it. These are things I deal with on a daily basis. And I think that the best thing is to trust the system as quickly as possible. Find you a good doctor. Find yourself someone you can connect with. And then understand that in everything that you are being told, this person's glory comes from you getting better. And they're not going to want to harm you. And there might be conflicting information, but you have to learn to put your trust in the medical doctor specialist who is taking care of you, so you can move forward very quickly.
Thank you. Nice one, Claire. So
thank you, Dennis.
We have to agree now that bowel cancer is still not widely talked about. We agree with that. But stigmatization and cultural silence must play a very big role in everything you've just said, because thinking about it, like you said, the people in the rural areas, how do they, if they're told? It's very sad, because I do have, I've seen at least 3 people this year who have died of cancer, who are not illiterate, but who would not talk about it because of stigmatization. So, Dr. B, how do stigmatization and cultural side affect our early detection plans outcomes?
So, the worst kind of stigmatization is even the self-stigmatization, where you feel shame because you've been diagnosed. by a disease and you're thinking that you don't want anybody to know. I used to have someone work with me, and she had breast cancer, and we would see patients together and she would not talk about it. Like, I couldn't understand what, by the time she was now revealing it, we were in very late stages, stage 4, God rest her soul. But it always bothers me how you can feel guilty for being diagnosed with a sickness, and that guilt stops you from communicating, from seeking help. You don't deserve cancer. It's not something you brought on yourself. It's something we should gather around you and help you, because it is unfair that you are going through what you are going through. That's a big part for me. Stop self-stigmatizing yourself. Open up. Dennis, when I say you are the poster child, and I know you always smile, I say, no, I'm just in awe of you and how hard you are fighting, despite how serious the condition that you are facing is. We spoke yesterday at length, and every time I leave a conversation with you, I'm wishing a part of your spirit could just fall on every cancer patient so that they can fight with everything that they have. They can ignore what needs to be ignored and just keep going and understanding that they can have actually a full, robust life outside of cancer. But in the general context, we need a mind shift. The churches, the religious leaders, generally speaking, that is, community leaders, royal fathers, we need to talk about cancer like we talk about the economy. You know, we need to make it such commonplace, because if the statistics for breast cancer is 1 in 8 women, that's a high percentage of women are going to come down with breast cancer. That's a lot, and we need to talk about it. Ignoring it is not going to make it go away. The figures will not change just because we don't talk about them. The figures will only change when we start to talk about them freely, but from a place of knowledge and not propagating stereotypes or misinformations. So I think that's the only way forward. You know, I don't want to take too much time. I can go on and on
I
about
know you
issues like
can.
this that mean a lot to me.
Yeah, we're about to close anyway. No. So I'm about to finish this, and I've got one last question for you. So cancer doesn't
Yes,
just
ma'am.
affect patients. We have to remember there are families in it. I know how my children have managed and navigate and keep navigating and keep just being grateful for each day I'm alive. So for families and caregivers, what would you say would be practical? Just give me 2 practical or 3 practical roles they can play after the diagnosis to at least help the patients. I could give you many because of my experience, but no, that's
Mhm.
based on experience. That's not so. You give us just 3 main ones as we round up.
So when someone is newly diagnosed with cancer, the bottom drops out of their world, understanding support. And that support is not just I'm here for you, it's I'm walking this journey with you. So things like sitting with them in silence sometimes when they don't need to hear anything, just being available, going with them for their follow-up and listening and taking notes and helping them make sense of all of these many complicated issues, treatments, pathways, and all of that. I think it is one of the biggest things that you can do. That strong support. Now, I mean, the bottom just dropped out of your own world too, but this person comes first, and you just need to be there and supportive as much as you can. Providing of funds is more important. In our culture, people are quick to pay lip service, but not because they think, oh, he's going to die anyways, there's no point spending money.
Thank
You
you.
know, it's something we come across out a lot. So helping financially is a big part. You see a patient and then somebody calls, doctor, you should say this man will survive this sickness. You know, they come back to come and ask you because they're already calculating that, oh, this 500K we're going to spend, that's a total of 3 million. Should we even be spending it now on this patient, or should we be thinking about burial? I think that's just unfair, because you know you need to support as much as possible with financial support to be there. I know we're running out of time, but I hope these 2 things will reach the right people and help them to do the needful to support cancer patients generally. Oh, yeah.
Thank you. You actually just said what went through my head. And it's something that I'm still going back to. I'm still waiting to see what the government's going to do about Blessing CEO. Because you just said it. You just said we were seen as dead. And so everybody's trying to look at the nearest money. And there's somebody thinking it's a joke. And then cracking joke and raising money on our expense. Anyway, we're still waiting on the Nigerian government. We're waiting on the people, relevant stakeholders, to please get Blessing CEO arrested. And we are waiting. Cancer patients are waiting to see the outcome for that. No matter how it goes, we'll still talk about it until we see what happens. Because she cannot be an influencer and influence badly to the extent, at the expense of cancer patients' life. Anyway, let me round up because you just said was what I heard, which was the last thing you said, and that was, we're seen as dead. We're not dead. I'm 10 years on.
Not at all. Not at all.
With the terminal disease. So what? Let's keep going. Bowel cancer is not a death sentence, please. The diagnosis is. The silence around it is costing lives. But conversations like this can change that, please. Doc, in a few words, that would you like Nigerians to remind you what would be your own few words? Give me few words.
So everyone, cancer is not a death sentence, and checking for it by screening is not going to invite it in. Rather, it will find it early when you can get rid of it and have more confidence that you can beat it. So please adopt screening procedures and start treatment as soon as possible. Thank you, everybody.
Thank you. So bowel cancer is treatable, especially when detected early. We agree. Do not ignore symptoms like blood in the stool or persistent changes in your bowel habits. Did you get in it? Seek proper medical care early. Avoid delay and self-medication. Screening is important, especially for those at risk. And support systems, no matter what. Just look for help. You're not alone. Common Cancer Consultation is always there for you. So, if you've noticed anything, any unusual changes, don't ignore them. Speak to a doctor. Get checked. Early detection does save lives. To you, my doc, I want to say thank you for joining us today. Thank you for your time. I know you're going into clinic very soon. Thank you for being here for us. And to all of you out there watching us, together we fight, together we win. We're about, as we close, we want to say, do not forget, follow the rules, follow what's it. Thank you for staying with us on Common Cancer Awareness on AIT. And please don't forget to follow us on all our social media handles, Common Cancer Foundation. Or you can look for me, Denise Ejoh, if you need help for navigating your way forward. Thank you. Doc, thank you very much.
All right, thank you very much, Dr. Denise Ejoh and the guest, Dr. Olutunde, right there. Such a conversation. As she mentioned where she started, bowel cancer is something that is not really in the news, and I'm happy that we're bringing it to the awareness of people, and even us here in the studio. Early detection would always be a conversation.
Yes, I've learned a lot from that, and definitely, keep my attention on everything surrounding my body. All right, up next is entertainment and lifestyle. To stay with us.